Well, we can know soon as Friday, if a judge here in New Orleans will allow Louisiana to implement one of the strictest abortion bans in the U.S. If the laws take effect, health experts say there could cause big problems for teens who get pregnant. As Eleanor Tabone reports, pro-life advocates say there are other resources young women could access.
Dr. Patricia Kissinger from Tulane University School of Public Health and Tropical Medicine says Louisiana ranks 7th in the country for teen pregnancy. However, she says with no access to abortion, those numbers could rise, along with higher rates of childhood poverty and decreasing the number of women in the workplace. Pro-life advocates say there are other resources young women could access.
The medical issues that it causes and the social issues it causes is really problematic.
According to Dr. Kissinger, in Louisiana, 82% of teen pregnancies are unintended, 24% of them ending in legal abortion. She says teens are more likely to have premature babies and 50% less likely to graduate from high school. She says teen mums and their babies are at greater risk of dying.
There'll be much more maternal mortality. These are children that are going to be less likely to survive. And if they do survive, the medical costs are going to be enormous.
We have over 35 pregnancy centers that help women, not just with when they're pregnant with their baby, but they help them afterward. They offer like parenting classes to get them through the right social service that they might need.
Sarah Zagorski from Louisiana Right to Life says the option of adoption will be discussed in schools.
Passed a bill that expanded the requirements for adoption education in the public high school setting so that they know about the adoption option when they face a pregnancy, whether that be an adolescent pregnancy or later in their life, a pregnancy.
The teen mom gives up the baby. There's psychological issues that will go on.
Zagorski says more funding was allocated to help pregnant women. Dr. Kissinger says it's not enough.
We secured almost $2 million to help women that are in that specific situation. So there will be more resources available.
They're providing resources for the birth, for when the woman is pregnant. And then when the baby comes out, the resources go away.
And while women face these tough decisions, the final answers might eventually be left with the courts. Eleanor Tabone, Eyewitness News.